This is an article that came out May 3rd, 2018, News and Tribune. And it just go to show you whenever you have drug addiction going on, disease will surely follow. And hepatitis A seems to be a very big one among drug addicts. And it's no different in southern Indiana. In the wake of a hepatitis A outbreak in southern Indiana, health officials in Clark County are working to increase the availability of vaccinations among the general public. Due to a limited supply, the Clark County Health Department is able to offer vaccinations only to uninsured and high-risk populations such as jail inmates and the homeless. But work is underway to implement a program that would allow for more widespread vaccinations, including those with insurance. The framework is there. And Clark County Health Officer Eric Yazel, we're still about 10 years out or so from being able to do that. Food workers at 4 restaurants in southern Indiana tested positive for hepatitis A. This is why it's really important to eat at home. You don't know what junkie they got back up in their kitchen making your food. In April, prompting officials in Clark and Floyd counties to urge vaccinations against the virus among certain populations. Louisville also is struggling with an influx of cases, which is magnified as hundreds of thousands of people have descended on the area for Kentucky Derby festivities. With employees of the 3 southern Indiana restaurants, Bob Evans on State Street, Tomo Japanese Steakhouse on Charlestown Road in New Albany, and Taco Bell. Wow. Taco Bell too? And Arby's? And Arby's. Damn. Confirmed with hepatitis A. And see, that's what I'm talking about. If somebody in that kitchen got it, then they're spreading it to all of the customers that come in there, especially if they're a cook. A kind of mass panic can grip the public. So far, there have been no foodborne cases, so far, of the virus in Clark or Floyd County. But Yazel said health officials work quickly to inform the public of potential exposure. Our concern is that can always change. He said of foodborne cases, we're trying to be as transparent as possible to the general public and try to educate and deal with the aftermath. That public panic spur Dr. Jeffrey Howard, Kentucky's acting commissioner of the Department of Public Health, to issue a statement Thursday stressing that it is safe for people to travel to Kentucky for Derby activities. No cases in Kentucky have been linked to food contaminations. Let me say that it is safe to travel to Kentucky and it is safe to attend the Kentucky Derby. We have not had any cases associated with contamination from a food worker, and the risk of contracting the disease from an infected food worker is very low. Howard's statement read in part. In Clark and Floyd counties, okay, so what they're pretty much saying is they are trying to go after the high risk populations. And I know the stories that I did out of San Diego, what they did was they sent nurses and people like medical assistants out on the streets to search for homeless people and just give them a shot right there on the spot to try to, I guess, lessen the amount of the outbreak they were having. That's the way they did it. And if they have a lot of homeless people in southern Indiana, they'll probably do the same thing. The hepatitis A cases in both counties have been contained to household contact with those infected. We're not seeing a random person with no known risk factors becoming positive. Okay. So Floyd County, which had 28 confirmed cases of hepatitis A since early February, with 2 more potential cases under investigation, established an education outreach program for the food service industry, which has been highly successful. Okay, so, all right. We've actually had a fairly good response, but not only with the staff of the health department, but also the community in general, Harris said. In Clark County, there's been 34 confirmed cases of hepatitis A. No restaurant-related cases have come up since a statement was released on April 27th about the Arby's employee. Damn, that scares me. That really scares me. I'm glad I don't eat a lot of fast food anymore. It scares me. It's not like you can eyeball these people and tell whether or not they have hepatitis A or anything handling your food. Getting a vaccine supply and getting the state's help with vaccinations has been a big roadblock there. We're continuing to work on that the best we can. Vaccinations make a difference. Hepatitis A outbreak at the Clark County Jail in mid-March has been tamed after the county received vaccination assistance from the state. Anyone entering the jail, general population receives a shot. Woo, that's crazy. We haven't had any new cases confirmed through the jail transmission in weeks, and we're taking about the most difficult population to try to contain it. All right, so what they're doing, they're probably making those vaccinations mandatory for those people that are in the prison population. What choice do they have? It's not like they have any rights. But here's another hepatitis A story. It's like they're cropping up every single day now, And again, this is, people that are not properly washing their hands, or they have some kind of fecal matter on them that's getting into the food. And you can also get this through sexual contact as well. It spreads very easy. And that's how many of these drug addicts are getting it, because they're sleeping with people for drug money. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. And if you have an Android device, please go out and get my app. Peace, family.